open the door. Hi, my name is Riley. I'm going to be your nurse today. Today we're going to be doing a test out. I'm going to perform hand hygiene, and can you tell me your name and date of birth?
Ty Roughguard, 10102.
Good. And are you allergic to anything, Ty?
No.
All right. So we're going to get started. We're going to first start with the pulse. So, it's already new. All right, good. So your pulse was 98 beats per minute, which is good. It had a +2 amplitude and regular rhythm. I also checked your respirations as I was doing that, and it was 16 breaths per minute, which is good. It's in the normal range of 12 to 20 breaths per minute. It was evenly symmetric, regular rhythm, and moderate depth. Are you in any pain today? Good. If you were, I would have to check the cold spa, but since you're not, I don't have to do that. Next thing I'm going to do is test your LOC, so can you tell me where you are right now?
Home.
And what are we doing?
Test out head to toe.
Can you tell me where you went to high school?
Duchenne.
What did you have for breakfast this morning?
Pancakes.
Good. And what is the next holiday coming up?
Mother's Day.
Good. My patient is alert and oriented ×4. Speech is clear and appropriate, and everything seems good. Next I'm going to assess your skull. Good. It seems round, erect, and midline and symmetric, so everything looks good there. Next, I'm going to test your cranial nerve 7, which is your facial. Can you puff out your cheeks? Can you smile? Smile with teeth, frown, puff or perk your lips, raise your eyebrows. Good. Cranial nerve 7 is intact. Next, I'm going to test your cranial nerve 3, which is your ocular. And just good. Good, and then if you could just follow this light all the way into your nose. Good. Your pupils constrict bilaterally. They are equal, round, and reactive to light and accommodate. They converge and they constrict, so cranial nerve 3 is intact. I will now just look at your exterior eyes, make sure there's no drainage or irritation. Everything looks pretty good, so you're all good there. Next, I'm going to just assess your external ears, making sure they're symmetric, there's no drainage. Is this tender at all? Nope. All right, so that's good. Now I'm going to be looking at your nose. So if you could hold one nose and sniff, and hold the other one and sniff. Good. They're patent bilaterally. If you could just look up for me, I'm going to look at your septum. Good. That is midline, so that looks great. There's no nasal drainage of any kind noted, so that is good. Now I'm going to be testing your buccal cavity. So if I could just look in there. Good, everything looks pink, moist, smooth, and free of lesions. Your teeth, actually, I'm going to look at those again. Good, you have 28 to 32 pearly white teeth, no decay, your gums are attached great, and there's no dental cavities or dental appliances anywhere. Your tongue looked moist, moderate in size, it had papillae, so that is normal. No lesions, and the ventral surface was smooth, pink, shiny, and it had veins, so that's all normal. I'm going to look at your uvula. Good. It was pink, there was no exudate, it hung freely, so that looked good. Your tonsils, let me check those again. Good. Your tonsils are appropriate in size. They have a +2 grade, or +1 grade. There is no swelling or redness or exudate, so that looks good. I'm going to test cranial nerve 9 and 10 now, so if you could open up and say ah. Good. Your uvula and soft palate rose on pronation and symmetric bilaterally, so that looks great. Next, I'm going to start doing your carotid pulse, so I'm going to use the bell of my stethoscope, and I'm going to auscultate first to see if I can hear any bruits, doing one at a time so I don't cut off circulation. Can you hold your breath? Good. You can not hold your breath. You can breathe normally. Sorry. Okay. Hold your breath. Good. So I didn't hear any bruise of any kind, so now I can palpate. Good. One at a time again, not to cut off circulation to the brain. And it was, everything looked good. I didn't feel any bruise. There was a +2 amplitude, and they were equal bilaterally. So now I'm going to auscultate for breath sounds. I'm going to start at the apices of your lungs and end at the base. And I'm also going to start at C7 and work my way down to the 6th rib space. And I'm going to listen for full inspiration, expiration. Moving side to side as well. Good, I'm going to go on the back now, making sure not to hit any bone of any kind. Good. Now I'm going to start on your right side. So you're going to lift up your arm for me, and I'm going to do right, upper, and lower. Or upper, middle, and lower, sorry. Upper, middle, and lower. And for your left side, I'm just going to do upper and lower for the 2 lobes of the lungs. Good. And I didn't hear any adventitious sounds. If I did, I would be hearing either crackles or wheezes. Crackles are exudate throughout the airways, and wheezes are constricted airways. If I heard coarse crackles, it would be like moist Velcro ripping. If I heard fine crackles, it would be like Rice Krispies. If I heard wheezes, sibilant wheezes, I would hear high-pitched musical wheezes, and then if I heard sonorous wheezes, I would hear low-pitched snoring sounds. So now I'm going to auscultate the heart. So I'm going to use both the diaphragm and the bell for this, and I'm going to start at your aortic valve, which is your 2nd intercostal space, right sternal border. Moving my way over to the pulmonic, which is 2nd intercostal space, left sternal border. Moving down to Erb's point, which is 3rd intercostal space, left sternal border. Then down to tricuspid, which is 4th intercostal space, left sternal border. And then down to your mitral, which is your 5th intercostal space, left midclavicular line. So all that looks good. I would again use the bell as well and listen for those sounds. Now I'm going to palpate for your peripheral pulses. So I'm going to do your radial. And then if I could see your feet, I'm going to do your pedial on both sides, please. Good. They were equal bilaterally with a +2 amplitude, which is good. Now I'm going to be testing for edema and color and temperature of your skin. Everything looks good. Great. Your color and temperature was equal. You had no peripheral edema noted. And then I'm going to look for your skin turgor. And it was immediate, so that is good. I will now test for cap refills. And it came back in less than 2 seconds, so that is normal and great. Now I will have you lie down. If you could lay down right now, I would have you lie down, and I'm going to just inspect your abdomen first. So I'm going to inspect and just kind of look at it, not touching. I didn't mean to touch. It's going to be evenly, I'm looking for evenly round, skin smooth, evenly toned, and no pulsations, so I don't see any of that. Now I'm going to auscultate with my diaphragm of my stethoscope, and I'm going to start in the right lower quadrant and work my way clockwise on the other 4 quadrants. Good. Okay. I heard normal bowel sounds. I would want to be listening for 5 to 30 bowel sounds per minute. If you had less than 5, it'd be hypoactive. And then if I heard more than 30 bowel sounds, then it'd be hyperactive. So I didn't hear any of that stuff. Now going to palpate your abdomen, making sure there's no tenderness. Going clockwise again, start at the right lower quadrant, going up and around, and there's no pain and tenderness, so that is good. Now I'm going to assess your muscle strength in tone and size. Everything seems symmetric in size, equal bilaterally. And then can you push against my hands? Can you pull them? Good. Can you push against my hands? Good. Can you pull them? Good. Everything is good in strength, equal in strength bilaterally. Everything looks great with that. Are you having any joint pain today?
Mm-mm.
No? All right, good. Just going to look for any redness or swelling in your joints. Good, and I don't see any redness, swelling, tenderness, or any heat around those areas, so everything looks good. Can you stand up, sir, and can I look at your, can you just walk for me? Good, you have erect posture, coordination, coordinated movements. Your arms swayed in opposition, and everything looked smooth and equal bilaterally. All right.